Lethal dose 50%, LD50, is the dose of a chemical that is lethal to 50% of the population of a particular species. Similarly, the effective dose, 50%, is the dosage that 50% of the population will be affected. A dose-response curve describes the effect on an organism or mortality rate in a population based on the dose of a particular toxin or drug. LD50 values vary widely depending on the test species and the route of exposure, which involves ingestion, inhalation, injection. LD50 values determine the safety of a substance and establishing guidelines for safe exposure levels for humans and other animals. There are lethal doses to anything, whether that be the coffee you drink every day or the soda you had for lunch. The lethal dose for water in rats is 6 liters within 3 hours. After this, the animal will die from even something as simple as water. LD50 and ED50 are important measures in toxicology and pharmacology. They are used to establish the toxicity and efficacy of drugs and other chemicals. The dose-response curve provides a graphical representation of the relationship between dose and response and can be used to determine the ED50 and LD50 values, as well as the therapeutic index. Understanding these concepts is important for ensuring the safety and effectiveness of drugs and other chemicals. There are 2 variables we must analyze. The independent variable in a dose-response curve is the concentration of a chemical. Scientists will give different levels of doses to a test species in an effort to see how much is enough to kill half of them. The dependent variable is the response by the species. The lethal dosage of the chemical is what your LD50 is. The lower the dose necessary to kill half a population, the more deathly it is. This means that a lower LD50 level will be more toxic than a higher one. LD50 data will be represented as a mass of the dose over the body mass of the test species. Typically, it will be grams or milligrams over kilograms. Now let's analyze a dose-response curve. As we go from left to right, the curve follows a logistic growth pattern, as shown by the S shape of the graph. The rate of change increases dramatically, but then, at a certain point, flattens out. What is known as the threshold of the graph is the lowest possible point and the earliest evidence of a reaction from the test species. How exactly do we identify what the lethal dose is based on the graph? It is quite simple. Just look at the numerical value where the straight line meets the x-axis. Whatever this number is will be your lethal dose for whatever drug you are testing. In this example, the lethal dose is 10 milligrams per kilogram. The effective dose graph is the same shape, but instead of measuring when half of the population dies, it measures when half of the population demonstrates a specific response to that exposure. You can place the effective dose and the lethal dose on the same graph. This graph shows that it takes less dosage to trigger the effect we are testing, but with more and more dosage, the effects start to turn lethal. We use these graphs to measure for a variety of effects. Some things that are tested for include infertility, paralysis, or even cancer. Let's look at a real-world example. Acetaminophen is a common over-the-counter medication used worldwide to reduce pain and fevers. In the US, it is sold under the trade name Tylenol, but it is also a common ingredient in other medications such as NyQuil, Theraflu, Robitussin, and other cold remedies. When used at therapeutic doses, acetaminophen is a safe and effective medication. Scientific research has established clear guidelines as to how much medication needs to be given for pain relief and fever reduction. This range is the therapeutic dose, a level at which the medication can be given safely and still trigger the desired effect. With any medication, taking too much can cause an overdose and be lethal. Ideally, there would be a wide gap between the effective dose and toxic dose. This gap is called the margin of safety. One of the reasons that acetaminophen is considered safe to use so broadly is that its safety profile meets this criterion. The therapeutic dose curve is very far away from the lethal dose curve. So with regular usage of acetaminophen, a typical patient would not come anywhere near the level that could cause harm. Other medications are not as safe. Cancer treatments such as chemotherapy and radiation therapy are designed to damage fast-growing cancer cells, but can also harm normal cells. These types of therapies have very narrow margins of safety and can often cause harm even at regular therapeutic levels. There is overlap between therapeutic effect and toxic effect curves. This may lead to death before the intended effect is even reached. The therapeutic dose curve determines how dangerous something like chemotherapy can be. Now let's practice some multiple choice questions. Chemical A has a lethal dose of 810 milligrams per kilograms. Chemical B has a lethal dose of 763 milligrams per kilograms. Chemical C has a lethal dose of 636 milligrams per kilograms. Chemical D has a lethal dose of 600 milligrams per kilograms. Which chemical is the most toxic based on its lethal dose? If you said chemical D, you'd be correct. This is because chemical D can kill you with a smaller amount of dosage than the other chemicals. Question 2. Which of the following is true about effective dose 50? A. It measures when 50% of the population dies. B. It determines when 50% of the population will be affected. C. It measures when 100% of the population is affected by a chemical. Or D. It tests whether or not a chemical works. If you said B, you'd be correct. Effective dose 50 tests for when a therapeutic effect affects 50% of a test population. Last question. What is the lethal dose of this graph? Is it A, 248 milligrams per milliliter, B, 500 milligrams per milliliter, C, 50 milligrams per milliliter, or D, 2.5 milligrams per milliliter? If you answered A, you'd be correct. 50% of the population is reported to die at around the 248 mark, therefore making the lethal dose 50% 248 milligrams per milliliter.